Right, so our main aim, we're a breast pump company, manufactured in Switzerland, we import into South Africa. The main aim of our pumps is to initiate the mom's milk supply. So we have a variety of pumps, from your retail pumps, which the mom would use at home, and then your hospital grade pumps, which the mom would actually use in hospital. So it's for a pump dependent mom. If a mom is battling to latch her baby, or the baby is in neonatal ICU, for example, she would use the pump to initiate her milk. We have different phases on the pump, from initiate, which helps bring the milk in, to build and then maintain. The maintaining would obviously then keep the milk at the level needed to feed the baby. Once you leave the hospital, each mom in hospital would get her own kit, which she would use on the hospital grade pump. So it's a multi-user pump. It can be used by many moms, but they each have their own hospital grade kit. Once mom is discharged from the hospital, she would then go onto one of the retail pumps, which she would use at home, especially if she's not getting the baby to latch, or if she's going back to work. So again, she would be pump dependent if going back to work and want to keep feeding her baby.